Hi, my name's Anna and I'm one of the lymphedema nurses at Accelerate. I'm going to be showing you how to do a thigh-high bandage today. Our patient Vicky has the liner in place. Prior to that, you would have completed all of your wound care and dressings underneath. So I'm going to start by protecting the leg with a layer of wadding. It's just to protect any bony prominences from the compression. So we're going to start at the base of the toes and apply this in a spiral fashion. So we're going round, covering 50% of what we've done previously. Most people need a little bit of extra padding just over the ankle flexion, so I'll do a pleat at the front, wrap this around the back, capture in the ankle. Then we're going to continue in a 50% overlap spiral. If you could just bend at the knee for me, please, Vicky. Just carry on going up. So just remember not to apply any tension with the wadding layer, otherwise you start stretching it out. We don't need that. So I'm just going to do below knee now. We'll move on to the thigh high when Vicky's standing. So once we've done our wadding layer, we're going to start with an 8 cm short stretch bandage around the foot. So we'll start at the base of the toes. So it's important when you're bandaging just to ask your patient to point their toes up towards their nose, just so we give them enough space over the ankle flexion and it doesn't become too tight. So we'll start at the base of the toes. Remember that we're applying full tension with our compression bandage. We're not leaving it loose, otherwise it's likely to slip, and it's certainly not going to control any swelling that they've got. So I'm going twice around the base of the toes. Then I'm going to come into the middle of the foot, covering 50% of what I'm doing in a spiral. Flat around the ankle, remembering to keep the tension at the back of the leg and rolling over the top. So we're going in a downward direction to cover up the heel. And an upward direction round the back of the ankle. So once we've done our foot in an 8 cm, we're going to change to a 10 cm short stretch bandage. We'll start at the ankle and go in a 50% overlap spiral up the leg. So we want it to overlap. So we'll start just at the ankle, again, remembering to apply full tension. Tug the bandage at the back of the leg and roll over the front. Tug the bandage at the back and roll over the front. So you can see I'm covering 50% of what I did previously. Tugging at the back and rolling over. So if you could just bend up again for me, Vicky, that's great. So once we've done our first layer of 10 cm, we're going to take a fresh bandage and start our second layer from the bottom, around the ankle, going up the leg, overlapping what we've previously done in the opposite direction. So previously I went clockwise. I'm going to turn my bandage so that we go anti-clockwise, and we're just going to go in that 50% spiral again, starting at the ankle, applying the pressure at the back, rolling over the front. So tugging at the back and rolling over the front. Now It's important that we try and go in an upwards diagonal, as this helps to prevent the bandage from slipping. Sorry Vicky, if you just bend at the knee for me. Cut that off. There we go. So we've done our below knee bandage. It's time to move on to the thigh. You can do this bandage when your patient is on the couch. However, it's much easier for you and a bit more comfortable for the patient if they can stand up. It just means that you can get behind the back of the thigh nice and easily. And also, if they can't stand up, because the thigh-high bandage limits mobility to a degree, if they've got poor mobility and aren't able to stand, it begs to question whether they should actually be having the thigh-high bandage. So my advice would be to do it standing up, but absolutely you can do it in the couch. What I do is prop underneath the ankle and the lower calf with a pillow, so that then obviously you can get your hand beneath the knee and the back of the thigh. If you need a little bit more access, you just ask your patient if they can bend their knee slightly and try and keep it propped up underneath the heel. So I'm going to be doing the thigh-high part of the bandage with Vicky standing up. I find that this is much better for access around the back of the thigh and puts the leg in a good position for the bandaging. Now, a top tip to make sure that we keep the flexion in the knee to stop the bandage from becoming uncomfortable is to use an old one of our bandages, a used bandage, just under the heel, which keeps the knee in the perfect level of flexion before starting our bandage. So we're going to do the rest of our wadding. Now, Vicky has a good shape to her legs, so I don't need to use excessive amounts of wadding. You may find with patients that you're bandaging their thighs that they might have an overhang around the knee, maybe some lumps and bumps here and there, and that's the best time to use your wadding to give you a good shape. So I'll give you some examples. First of all, you need to start the wadding overlapping our previous bandage. The problem is if you start it higher up, when you apply the compression, it's just going to split the bandage. Now we want to protect our bony prominences, so we've got our kneecap here, so I'm just going to do a pleat here just to give some protection. And also the bandage can get a little bit uncomfortable behind the back of the knee, so we're just going to do a couple of pleats here. Just go back and forth and then continue in this upwards spiral. So say for instance you had an overhang on the knee here, we can use our padding to give us some good shape, and we need a cylinder shape to prevent the bandage from slipping down the leg. So if I notice that there was a gap, I can use my wadding, again pleating back and forth just to fill in that gap. So then I would want to see a nice uniform shape there. Vicky doesn't have that, so this is the perfect amount of wadding. So the next step is using a 12 centimetre bandage to go up the rest of the thigh. We will be doing 2 layers. It's exactly the same as the below knee, it's simply that it's going above knee and in a wider bandage. So again, we want some overlap so that it adheres to the adhesive of the previous layer, remembering that we want full tension. So we pull at the back, and we're going in again a 50% spiral. Tug at the back and roll over the front. As best you can, you want this going in the upward diagonal, again to stop it from slipping. So once we get to the top, we're just going to flatten out the bandage. And then we can cut that there. So we're going to turn our bandage round to go anti-clockwise around the leg, exactly the same as the below knee. So again, where we were going clockwise before, we'll turn the bandage round so that we go anti-clockwise. Again, we're going to start below knee, rolling the barrel of the bandage round, pulling at the back, rolling over the front, and going in that upward diagonal. So you can see I've asked Vicky to hold on to the couch. You just want to make sure that your patient's got something to hang on to, because as you're pulling, you don't want them to topple over. So keeping it in a nice upward diagonal, flattening off around the top. There we go. Then the excess of your liner that you have at the top, you can just fold over that part of the bandage. And there we are. And that's our thigh-high bandage complete. So as you can see, it's not that scary. It's almost identical to a below knee bandage, just above the knee. So I hope that you found this informative and helpful and something that you can use to benefit both you and your patients.